All right. Very good. Glad you can hear us. So we're happy to be back. We're back with you today to talk to you about corporate versus private dentistry. And oh my goodness, so sorry. So um, so before we start, for any of you who weren't here with us last time or during our last series, we thought we would just tell you a little bit about ourselves again. This time, I'm going to introduce myself, and Dr. Studley is going to introduce himself, and you can let us know which way you like it better. So, I'm Dr. Ivy Peltz, and I am a retired dentist. I just retired this year from private practice in Manhattan. I also was teaching at New York University College of Dentistry. Some of you may be familiar with that school. I taught there for over 30 years, and I was a group practice director there for over 20 years. And while I was doing all of that, I also got a master's in higher education administration and then a PhD in higher ed, as well as a master's in the Academy of General Dentistry, which is something that I really hope that all of you to-be general dentists out there will consider joining, because it's a very good um, uh, organizational tool for your continuing education, if nothing else. It helps motivate you to achieve certain goals, which is great. So I hope you'll all consider that as you move on in your career.
So now you could see with all of the degrees, that's why I have Dr. Peltz introduce herself, because I just would not remember all of those things after the name. Um, I'm Dr. Eric Studley. I graduated from NYU in 1985. I went into private practice right after graduation and opened a practice about a year after dental school in Sheepshead Bay, Brooklyn. I practiced there for a number of years. I was also on staff at NYU um, right after I graduated, so I worked there a day a week. And then as my years progressed, I, went more into academics and started teaching at the dental school. Became a full-time director. I was there for 33 years. I was also the director of practice management, which was at the time a 3-year curriculum for students from D2 to D4. And some of the D4s would even, from NYU, I taught ergonomics as well. I also, due to certain circumstances, I also started going into insurance, and I started my own insurance brokerage company, which is now almost 28 years old. And we specialize in all the insurance needs of dentists throughout the United States. So it's something that, myself and Dr. Peltz, all of our years of kind of doing a lot of these things and the experiences, but then also working with students has really, given us the knowledge, let's say, what we've learned and what you guys have taught us.
Mhm.
So, so much of what we talk about is the views of what we've come up with. And we always
Having been
recommend, right,
exposed to all of you.
to all of you.
So we both left out something very important,
Yes.
which is that we are also the co-founders of Doccupations. So Doccupations is a subsidiary of Eric S. Studley and Associates Inc. And right now you are all entitled to free memberships. So you can go to www.doccupations.com. And when you get to the billing page, put in promo code, all capitals, ESS Cares. And that has just appeared in the chat box. So if you didn't have time to write it down, don't you worry about it, just cut and paste.
So tonight,
Yeah.
This is also like one of the topics when we speak in all these different schools, corporate dentistry versus private practice dentistry.
Mhm.
And we always have to, first of all, it's really not one versus the other.
And even more important, we can't really give you an answer, because whether or not corporate dentistry or private practice is going to appeal to you or be right for you is dependent, number one, on you. And number two, even as much, is the time in your career. So there might be times in your career where corporate dentistry is perfect for you. And there might be other times when you want something different. And you're really the only one who can know that. So we can't really answer which is right for you. But what we can do is tell you enough about the two of them, the two different modalities, that you'll be able to have a little bit of an understanding of which you might be more interested. And then there's the practical piece of which jobs are available
Right.
when and where you're looking. So, you're not always going to get what you want, especially in the beginning.
So it's also important that, making the next step, whether, from now going into a residency, and then, which, if you can, and I know that people are still trying to get some of the, post matches. Um, if that's something that, you went for, that's great. And we're big supporters of just lifelong learning. So you can never learn enough. Um, but once you start working for someone, right off the bat, it's going to be more or less no different whether you're working in a private practice, or in a, a corporate type setting. You are going to be an employee.
Mhm.
And I know for myself,
And in this sense, when we talk about an employee, we're including independent contractors,
right,
because really doesn't matter what your status is in terms of your tax reporting. You're going to be treated like an employee wherever you go. And a lot of what we're talking about, even though we might couch it as corporate versus private, is really employee versus owner of a business. So
right.
there's a lot of it that's just that whether you're in a corporate practice or a private practice with a boss, there are some disadvantages to that scenario.
So, that in and of itself, you know, is sort of what compels us, or some of us, to want to start our own practice and, have that kind of independence. It is important, though, that you try to get the experience of working for someone else, and not only just for someone else, but maybe, if you have the, the opportunity to work in different types of practice settings.
It's also, some students would come to us and say they have a job lined up after graduation. They know somebody who, wants to take them in as an associate, and eventually they're going to be a partner, or whatever the scenario is. And I don't remember discussing this with you recently, so it'll be interesting to see if we agree. But I never feel that that's a very good first job, the practice that you want to wind up in for the rest of your career, because in at the very beginning you have a lot to learn, and that learning process may not sit very well with the person who initially thinks that they want you to be their partner. So you may want to get a little more experience under
Mhm.
your belt before you actually go into that practice. You don't want to be frank, you don't want to make any mistakes, for lack of a better word. You have an improvement on
Right.
that, on the people who are going to be your patients for the rest of your career, or who are the patients of this person who means so much to your career. You still have
Not that you should
learning
make
to do.
mistakes
You're
on
not going
any
to make
patients,
mistakes, of
but
course, but
you're a novice at this.
yeah,
No,
things happen, and it might be good to have a little separation first and a little more development. And I don't think we emphasized enough today how much we think it is important that that you do a residency program after dental school. So you have an awful lot packed into your curriculum. And in your cases, you were robbed a little bit, deprived of your school time. And that all matters, even though I'm sure your faculty are doing the best they can to teach you as much as they can in the time they have. You did miss out on some opportunities there. And you have to make up for that because you can't just, there's a lot that you don't learn while you're in dental school, no matter what happens. But in your cases where you were cut a little bit short, time wise, you're going to have some voids in your knowledge. So it's very important to fill those before you're out on your own, or, you're going to feel uncomfortable.
Well, with some, if you're not going to have that opportunity, then you're going to have to make the most of every opportunity that you can start with.
Hmm.
So if it's a matter of not just corporate or not just private, and you have to get some kind of combination if that's available, or if you have to get 2 days in one office, 2 days in another office, 2 days in another,
Hmm.
those things, those are options out there. Like you said, you're not always going to get exactly what you
Right.
want at the beginning,
Yes.
but doesn't mean that you can't, make it happen, towards the end.
Right.
So when we start to talk about, that corporate type of dentistry, um, the reason why that has become so popular is because they are in so many, throughout so many places throughout the United States, and they are able to offer, that corporate type of, business package, um, where you shouldn't also think that some of these group practices that are out there, these multi-doctor type practices, a lot of them will also offer very similar types of benefits, even if they don't own 12 places, 10 places, or more. Um, some of these offices, they still have these types of arrangements. So it's not just that it's only to a corporate setting, because you really can get this. Um, and as more and more dental practices are being run as, business corporations, uh, and hiring more and more type of employees, they are, getting these types of benefit packages. So you shouldn't just count out that some, practice may not have these. But on average, um, we've seen that the corporate offers um, might be higher than you might be getting from a private practice, especially because the corporate office might be more um, likely to hire a new grad as opposed to, um, let's say, a very high end fee for service type of practice, who, not to say that they won't eventually hire you, but they may be looking for somebody that has 1 to 2 years experience.
They'll often say GPR or 2 years
Right.
experience required. So, if you don't do that GPR, how do you get the 2 years when they all say that? It's a little bit of a catch 22.
Right. So, it's like anything. Nobody wants to hire you for your first job, but they all want to hire you afterwards. So, you have to get started in this. So that's why sometimes there are opportunities with corporate dentistry that will, and, one of the things that we'll talk about or mention, um, the contracts that you have to sign though with the companies.
Hmm.
It's with most of the corporations, it's not like you can sign and then if you don't like it after 2, 3 months, you just say, thanks, it was great, see you later. No, these are very, legally binding types of contracts, um, that, number one, you shouldn't sign until you get the proper legal advice. But one of the things that you have to keep in mind is, depending on what your plan is, make sure that you tailor the contract you're signing with this group to kind of fit that future plan. Um, but on average, the salaries are higher. But I will say, um, pre-pan pre-pandemic, yes, on average, you could see contracts upwards of 150,000 on a guaranteed type salary. Um, that with also a different incentive type of bonuses, um, depending on quality. There's also um, now though, post pandemic and moving forward, some of the offers are not as generous, um, but yet still within, just to let you guys know, the national average for a practicing dentist throughout the United States is 150,000, which is pretty high. Um, dentistry was also voted the number 10, top 10 profession to be in,
Mhm.
as well. So that should make you feel good, graduating, into this. But the idea is that the corporates might give you that kind of stability, so that you can get that 2 years under your belt, and then your plan is to move on.
Mhm.
So that's important.
Or you might want to stay.
Right.
So again, it depends on you and what your goals are.
Right, because one of the other benefits with working with some of the corporations, some of them have programs where, as the longer that you stay on and you show your growth, they will at a certain point allow you to um, get ownership with some of their corporations,
Mhm.
their other dental practices. So if that's something that that is in your plan, once again, that is something that, um, you should really look into.
So when you think of corporate versus private, you don't necessarily have to think of it as strictly employee versus owner, because the corporations, some of them do offer this pathway to leadership where you will become like a, a practice owner in some cases, or the manager, the
Right.
managing partner, or some other leadership position. So you don't have to write off the corporations just because you want to have your own practice. That might actually be an easier way to developing a practice depending on where you are.
So some of the things also that the corporations um, that will offer, malpractice insurance.
Hmm.
Um, so a lot of these places, because of number one where they are and the large amount of patients that they see, they have malpractice. This way that you're covered, working in their locations. Um, so most of the time, we've seen in their contracts where they will pay, um, as long as you fulfill your end of the bargain. Um, some of them will also offer long-term and short-term disability insurance. Now, the important thing with any of the benefits that are offered, so if you're offered any types of insurance benefits, like life insurance, um, your long-term disability insurance, you want to also make sure is that type of insurance portable, meaning I work in company A for 2 years. Now I'm going to leave, and I'd like to actually take the benefits with me. Are they portable? Can I take them with me? It's important to know that because that'll also help you with your insurance planning when you start working as well.
So before we move on, I want to mention that as new dentists, you're going to need malpractice and disability insurance, whether or not your employer provides it for you. So sitting right next to me is an insurance expert. Dr. Studley is available if you have any questions, or if you need any guidance as you move forward in your career. You can reach him at insurance@drericstudley.com.
So, continuing with benefits, some of the um, large organizations will give you a retirement plan. It's called could be called the 401k, as an example. So that will be a certain portion, as you earn, the company will put away a certain amount of money for you as well. So, these are certain things that also add on to your, let's say your compensation package. So, you
And
might,
I'm sorry to
yeah,
interrupt, but when you're negotiating, when you're talking about salary, when you get to that point in your negotiations, it might be easier for an employer, either private or corporate, to consider benefits for you than it is to
mhm,
increase your salary for whatever logistical reasons. So always remember that there are always tons of different types of benefits that you can request as part of your package. And as Dr. Studley said, those translate to money when you think about the whole
right.
thing.
Just as an example, even a lot of times, some of the public assistance loan programs, or the public health um, practices. A lot of times, students are, oh, but they're not offering that much, in salary. But there might be, loan repayment
Right.
and, all these other types of benefits that could add up to being more if you had to earn that money to pay for those benefits. So, sometimes that the benefit package, as Dr. Peltz said, could be worth more than if you actually got the dollar value of it in the long run.
Hmm.
Um, Health insurance is another thing that, first of all, is quite costly. And if you're able to get covered under a group plan through your employer, um, that, is in and of itself, is a very expensive, I don't want to say commodity, necessity,
Hmm.
to get.
Necessity.
Um, Another thing is relocation. So if now you're here in New York, let's say New Jersey, Connecticut, but now, you're going to be taking this position in Texas and you have to relocate, move. Um, you could try to negotiate also to get relocation expenses. And a lot of times the larger practices will do that. I know prior to the pandemic, if you would interview with a lot of them, they would actually send you plane tickets, and you would fly there. More of an in person interview, you'd get to see the facilities, that kind of thing. Unfortunately, now, um, all of the interviews, like everything else, is being done virtually.
Hmm.
Um, Another benefit that we see from corporates, but also in a lot of dental practices, is continuing education. So you would like to, you get continuing education because once you graduate, you have to start, in order to renew your license,
Hmm. At a
um,
minimum.
at a minimum. Um,
At a minimum, there are post-graduation
right,
requirements during your license period, which, depending on the state you live in New York, it's 3 years. For every 3 years, every dentist has to take 60 continuing ed requirement credits. So each
mhm,
hour is a credit. And that's something to keep in mind, that even that's why we're saying at a minimum, you have to
right.
at least get 60 continuing ed credits every 3 years, which really isn't a lot when you think about it.
So normally you have to pay for this, and some of these courses could be quite costly. Um, so a lot of the benefits that are also included are what they call a stipend, or they'll give you a dollar amount and say, we'll give you $1,500 a year towards continuing education credits. So once again, these are all things that get added on. And then, and may not be so much post pandemic, but eventually things will get back to normal. In the past, depending on the locations that you were willing to go to, um, some of the corporations were giving an additional sign-on bonus, as an incentive to go to a location that might be somewhat remote, but it might be worthwhile for you to get that additional dollars. So, these are some of the things that you'll see in a corporate type of, benefits package. And I know we got, a lot of questions, about, what other benefits
Right.
that we, can get from them.
And to emphasize again, that doesn't mean you won't get that in a package from a private practice, but it's there. These types of benefits are very commonly
Right.
offered in employment contracts given by corporations. And for a solo practitioner or a private practice hiring an associate, it might be something that you might have to bring up. Would you consider, since I was thinking I was going to earn a little more than you're offering, would you consider including a continuing ed stipend? So that's something that, a good employer might be willing to consider, something like that.
Right. There was actually a question on what are some of the things that we could ask for or
Right.
negotiate. So really, these are things, when you're in that. But I will tell you, if you go on the website of all these corporations, they actually post what they offer because it's a selling point, and they know that. So prior to you even applying anywhere, you could really look at all the different types of, when they say, benefits offered, and you could really, compare, because if that's, something that's important to you, it's a great starting point to begin with that. Also, corporations, and especially for those that are looking for sponsorship, the corporations, because of their size, because they're so large, they're accustomed to, doing this. Make sure when you are applying, if you are looking for a sponsorship for citizenship, that you ask them ahead of time. And once again, on their websites, they might even list that as well. But if it's not, and you are interested in that, that should be one of the first questions that you're asking, because that's one of that's the most important thing that you're really looking for when you're starting to work there. When we also talk about, that's why we mentioned at the beginning, pros and cons. So now some of these things, about the benefits of, continuing working in, that corporate type of setting is really no different than working, for a solo practitioner,
Right.
or, a multi-dentist.
Right.
And that is working in a modern facility. Now more than ever, because the protocols have, really taken a step, well above. But, we've seen, when we've been in a number of different places throughout the country, the corporate type offices are, set up, quite nice, well, open. And so it's important that you want to be starting your practice and continue to practice in an environment that you feel comfortable in, that is to the right standards. And, these types of practices, especially the large types of facilities, they really, make sure that they adhere.
So they may have, for example, an OSHA compliance officer and, a HIPAA compliance officer, and that all gets taken off of you. So one of the benefits, or not benefits, or, you, again, with all of this, you can do whatever you want with it. But one of the features of working in a corporation, if you don't want to, climb a corporate ladder and become and groom yourself for a leadership position, one of the features is that you don't have to assume any of the management responsibilities. So we were saying earlier that It also depends on the time of your career, which might be better for you. So in the beginning of your career, you're still really just you're getting the dentistry down, right? So you don't really need to take on all of these administrative responsibilities at that time. It would be nice to learn them, especially if you have the goal of going into your own practice one day. You really need to know how to do all of that, but there's a big difference between learning how to do it and being responsible for it. So that could be a big advantage at the beginning of your career and also at the end of your career when you're just tired of bearing all that responsibility and you don't kind of really want to give up dentistry yet, but you really don't want to have the hassle of, like, your dental assistant calls up in the morning and can't show up, and now you're facing 10 patients without an assistant. You don't want to do that anymore. So you'll see that at the end of career, a lot of dentists will sell their practices to corporations, but stay on as an employee in their own practice where they're now just collecting a salary rather than having to be responsible for the running of the practice.
So, not wanting to or not having to deal with all of the management types of things, especially when you're first starting out. So you could really focus on patient care, um, taking that kind of pressure off of you at the start um, is really important. So, but it doesn't mean that you shouldn't also start to pay attention to those kinds of things. We had a question somebody asked, um, if even if I work in a corporate, how am I going to look, when I go apply, and I want to work in a private practice type of setting.
People seem very worried about that.
Right. And, in one aspect, if we just think, and I remember, when I first started working for these other dentists, every single day was a continuing education course because you would learn some really good stuff, and then you would also see some stuff maybe that you didn't agree with. So you kind of learned what was really good and what was really bad, and you were able to form, your own opinions. But it was a great way to learn. So when you go to work for anybody, you should really just, focus on soaking up everything that you can so that when you do want to move on, and now if you're going from that corporate setting and you want to go to the private setting, you can say everything positive that you have learned. And you really shouldn't stress, the negative things that you might have, not necessarily learned, but were that you wouldn't do, and just focus on all the positive things that you learned, because you will learn positive things anywhere that you're going to be, and you may see certain things that you're not going to like, but that goes back to, well, that's why then if you don't like it, you have to move on and then start your own, right? Because that's the only way that you're going to may achieve true happiness. Or not.
So with these webinars, what we're going to do is set you up for this next phase after dental school, because a lot of times in the dental school curricula, we know that you're not really taught enough about this. So next week, what we're going to present to you next Wednesday, February 10th at 7 o'clock, is insurance needs for the new dentist. So that sounds a little dry, but before you start, you need disability and malpractice insurance, and you're about to make a purchase without knowing what you're buying. So we want you to understand what you're about to get. And as we say, you have an expert right here. So we hope that you will tune in next week at 7 o'clock. And if anyone can think of a very exciting title for that seminar, we welcome all of your ideas.
As we had mentioned earlier as well, there might be in some of these offers, room for advancement, going from managerial type of positions to, ownership. And once again, these are really written on their corporate like benefits kinds of things. So the dental practices that will offer this to you, um, I've seen them like the offer is at the very, very beginning so that you know exactly what has to be done to reach these different levels to go to that, as Dr. Peltz mentioned. And if that's really what your goal is, once again, focus your search, on these places that will, because they're out there that will fulfill um, your current needs, for the eventual future needs.
And the trick also is mainly to know what you want. So, and then even if what you want isn't available, just keep your eye on the prize. Like everything is a stepping stone to what you want. So let's say you want to work in um, a practice that mainly focuses on high-end cosmetic dentistry, as they call it. I say, what's uncosmetic? Like what dentist is saying, I do uncosmetic dentistry. But anyway, that's, just my little thing. So high-end, that's your goal. And when you get out, nobody wants to hire you initially for that. None of these high-end dentists are like, oh, how beautiful. You're right out of dental school. Let you work on my patients. That may not be what's happening right away. So you take the jobs you can get and you build your experience and you build your resume and you make yourself stronger with every step. And eventually you go and apply for those jobs that you wanted once you have a little more experience. And maybe from those, you learn how to have your own high-end cosmetic dentistry practice, and then you can take it from there. So don't get discouraged in the beginning if it feels like you're never going to get what you want. You will. You just have to give it some time. Why should it happen right away? That doesn't even really make any sense. Think about it. So
that's why, when you do start, taking courses, your CE courses, don't take credits just to kind of get the license done. Take the courses that you felt in dental school that you needed more and more and more, and then take the courses that very little of that you want to gain an eventual expertise in.
identify your weaknesses. If you feel like you're a little weak in endo, then you need to learn everything you can about it, because right now it's all on you. Once you get out of dental school, you don't have the luxury of going to your faculty anymore. You're responsible for the treatment that you render. So you have to make sure that it's going to be good treatment. But we digress from the advantages and disadvantages.
And one of the last, let's say, not one of the last, but just to mention, and you could think of this as a good thing and a bad thing, the staff is supplied for you. So, you come to work, the staff has a schedule, they're run by, a completely different team, you have nothing to do with that. And, if all goes well, you have an assistant, chairside with you, completely for the whole day. You have to understand sometimes things do happen someday, especially when you own an office. You'll see if someone doesn't show, but the fact that you're not going to be in charge of the hiring and unfortunately at times terminating of employees, that's something that's really taken off of your plate.
And so that's one of the points we're trying to make, is you can look at any of this however it suits your personality. So you can say, that's great, I'm not in charge of the staffing. Or you could say, well, I'm paid on collection and I'm not in charge of the staffing, but your front desk's inefficiency is resulting in my not being paid what I should be being paid, but I don't have any power over the hiring. So it really depends. Are you a person who's going to go in and see how systems aren't working to your standards and be distressed by that? Then you probably need to own your own practice. If you're someone who doesn't want to take charge, who really enjoys, You go in at 9, you leave at 5, you leave and you're not really thinking about much other than, maybe some complicated cases, but you don't really have to think about the running of the practice. Then you want to be an employee, and maybe you'll want to be an employee for your whole entire practice, your whole career. And that's totally fine if that's what suits you. So that's why we can't really answer the question. All we can do is tell you the advantages and the disadvantages of each situation.
Right. So, when we started this and said it really has to do with, working for yourself or working for someone. So there's always going to be that. And when you are working for someone, you do lose, certain freedoms. The schedule is kind of given to you. Patients are put in sometimes, without your say.
I remember being shocked that I had to request vacation time.
Right. And
You know,
they
I
want
guess,
notice.
yeah, notice. And, as far as I was concerned, if there were no patients in the book for me that day, I didn't need to be there, but my bosses didn't seem to agree with that. So, yeah, some of these things are kind of surprising when you're not, when you don't know what to expect.
But that's once again working for anybody like that. You will also, in a lot of these places, as I mentioned earlier, you're going to be under contract. And that contract is, and can't stress enough, it's a legally binding document that you will be held to. So that, if you just decide, I don't want this anymore.
Which happens frequently in the beginning.
Right.
Because you accept a job, because it's a job and you need one. And then in a few weeks, you realize that you're horribly unhappy there. You're being asked to do things you don't think are right. Whatever, you can't get along with your boss. You can't stand the staff. You don't have a staff. Whatever the reason is, you don't want to stay.
Mhm.
But now you've signed this contract and you have to.
So that's why it's, so important to make sure that the right attorney that really is versed with dental employment type of contracts helps you at the beginning before you sign anything. It's always tougher, having to do this, and now you want to try to fight the contract. And first of all, it's quite costly, and it's just something that
Then you'll need to pay the lawyer that you should have paid to read the
Right,
contract
at the
in the
beginning.
first place.
and
Right.
it'll cost you that much more.
Much,
So,
much more.
um, these types of agreements will tell you the hours that you have to work. Like you said, vacation,
Mhm.
exactly when they're closed, so that you don't have to work.
Or you can't. So, the office is closed and you don't want to take a vacation that day, but they're not open. You have a forced, probably unpaid vacation, depends on the
Right.
terms of your contract.
Because it just says these are the days we're closed. These are the days that you get off. I've also seen, it'll also say the days that you cannot take off, like certain holidays. That you 3-day weekend. Well, it's a busy for 3-day weekend for a dental practice, and yes, maybe the owners won't be
I
there.
was going to say, or the owner wants 3-day weekends all
Right.
summer long. That's why they hired you. So.
Right. So that'll be in there. Another thing also, you might work in a facility, and this has to go anywhere that you're going to start working, where you're going to feel pressure to produce, feel pressure to do procedures that you're not really fully comfortable about doing, but they put it in your schedule, and you don't want to tell, I don't really want to do this, when really during your interview it should kind of be made clear. It's like, no, don't give me bony impactions. I don't want second molars with 4 canals. Like, you really should be upfront, because that also will let am I working in a place that will be like that? Am I working in a place, are the treatment plans being done for you? And now you have to go in and pretty much, do the treatment plan that's been given. These may be situations.
And that could be a fine situation, but you need to have a game plan for what happens if you examine the area and don't find what the original treatment planner has come up with. So you just need to know what you're getting into, because there are going to be differences of opinion for
Mhm.
sure.
Also, when you go to work for anybody, and dentists, we are artists. So like anything, we like to choose our own labs.
Mhm.
We may have a lab that does this and then another lab that does
Or
that.
supplies
Right,
or
supplies.
equipment.
So when you work in a lot of these places, you have to work with certain labs, um, because these are where they have the most experience with, and they might have the right costs with these labs. So you really don't have, it's like in dental school, you don't have a choice what labs, any of your lab work is going out to.
Mhm.
It's kind of just, it's a given.
Can you refer out a case if you think it's outside of your scope of practice? Well, as a dentist, yes, but as an employee, you would want to talk to your employer about what, because maybe, let's say, the four canal molar endo, second molar. You don't feel qualified to do that. You would refer that out, but maybe your employer would do that endo. So you're not just going to make decisions like that as an employee without having some understanding with your employer.
Right. First of all, you shouldn't do it, and you should. And this also should be discussed. Um, are there specialists that work within the practice?
Mhm.
So first of all, you wouldn't get that, or let's say just in case, you got it as an emergency. But are there specialists in the practice that you can refer this to, or do they have a referral group? They send their endo here, they send their perio here, that kind of thing. Um, and you should never be felt forced to have to do any procedure.
You always have to remember that you're responsible for
Right.
any procedure you do. Doesn't matter if Dr. Jones did the treatment plan and initialed it and signed it, and that's the owner of the practice and your
Mhm.
boss. None of that matters. You rendered the treatment, you're responsible for the treatment. If there's a problem and you didn't agree, you shouldn't have done it. So, and it doesn't matter if it's your employer who's asking you to do something you don't feel qualified to do or don't believe you should do, or if it's the patient who's asking you to do that. You don't do it. If you don't think you should be doing it for any reason whatsoever, don't do it. So right now, it's time for the $5 Starbucks gift card.
Mm.
So please fill out the form in the chat box and we will email you your $5 Starbucks gift card, because we are hoping that while you're sitting in Starbucks having a cup of coffee, you're going to be thinking about us.
Right. And when was the last time we sat in a
It's been
Starbucks?
a while, but they're out a little more than we are.
Right.
So,
So as we continue, as we get towards the completion, um, once again, working, in any type of setting, um, the materials. And, I could just say, being in a dental school environment and teaching in the dental school for so many years, the materials that the dental school, they were really, really good materials.
mhm.
Um, the students were really exposed to, some of the top level stuff that, practitioners out there might not even be working with.
Mhm.
And now they go from that level and they start working in other practices, and the bonding agent, it's not what they're comfortable with. The composites are different.
And if you're working for an employer who is not as up to date as you are, just be careful about how you try to introduce new things, because they're probably very attached to their ways. And even though you may have learned and know that your way is actually, more up to the standard of care, more compliant with the standard of care, they may not want to hear it. So feel the situation out before you start jumping in with suggestions of your own.
and, lastly, one of the things, at least, reason why I went into dentistry, um, is also because of the relationships that I was able to develop with my patients.
Yeah.
You know, um, even at the dental school, for, over 30 years, even in that type setting, um, we really were able to develop relationships. I had patients that were coming in for 20, 25 years there. So when you're in any type of setting, you first of all have to look at it as, this is my own practice. That's how you have to treat it. Because if you have that type of mentality, the patients will feel it. So it's really important to get that point across to your patients through, caring and trust. Um, Unfortunately, when you do work in some large group practices, whether it's in the corporate or a large group practice arena, you may not build that type of relationship, you know, with the bulk of the population of the patients there. Um, because
But it does depend
on the
on the
person,
practice. Some
right?
of those practices, you may be the only dentist there. Others, it may be that the patient doesn't get an appointment with you, they get an appointment with the practice, and there's no continuity of care.
So, these are just things, and once again, as their advantages, disadvantages, it really is, almost like a list of things that you should look for when
Mhm.
you are looking for that, you should have the perfect job that you want, and then the one that you'll accept. Because unfortunately, most will have to make some type of compromise, simply because it's just not yours yet.
Mhm.
All right. So I think we covered a lot of stuff here.
So at this point, first of all, if you have any questions, please feel free to type them into the chat box. But I would like to announce the Amazon gift card winner. But
Wait.
before I
Da,
do,
da, da, da.
but
Go ahead.
before, I just want to say that not only don't we know in advance who's going to be attending, but we, Dr. Studley and I, we have nothing to do with picking the winner of the Amazon gift card. I want to make that clear, because the winner is Lana Hune of NYUCD, who was my student. So congratulations, Lana. And
let's see,
if
let's see
you're
if Lana's here.
please type in yippee. Oh, I see a thank you. Yes, so
Okay.
it's so nice to see you. It's wonderful to see our old students, but we love having new students
Yes,
as
we
well.
do.
And you are all now our new students. And as a result, if you have any questions, please feel free to email them to info@doccupations.com, and we will answer your questions. And for now, I think we'll say goodnight, and we'll see you next week when we're going to be talking about insurance for the new dentist, unless you can think of a better name for that.
Good night.
Thank you.
Be safe. Bye-bye.
Thank you so much.